Hi, appointment with Faith Ann.
Good man.
Uh-huh.
Go ahead and take you back this way. Yeah. How you doing today?
Good, thank you.
And they didn't do anything to fix it. We'll get you on that longest chair all the way on the right.
Thank you.
Hello, Zoom caller.
Yes.
To make sure that you're aware that you're not muted at the time. We have not started the meeting. But if you want to mute, that would be great. And I will send you a message in the chat. If you have comments to make during the open forum.
Okay. All righty, I'm doing it now.
15 miles and I met Dr. Dodging Biscuit. I'm serious. Well, it's the ghost poop is overwhelming. Last night. Behind the trial. How are you doing? How was that game this week? Stop.
Good morning and welcome to the Mississippi Board of Nursing. At this point, we would like to call Ms. Lacey Gentry to lead us in prayer.
Will you bow with me for a moment of silence and prayer, please? Gracious Father, we praise you for letting us see this day. We praise you for the profession of nursing. and all the good we do in the state of Mississippi and beyond. I thank you for the staff here at the Board of Nursing, all the good work they do, Lord, behind the scenes that we never know about. We are so grateful for them. I praise you for this board members and all that sit on this board. I ask that our decisions today be made with discernment and wisdom to further your kingdom. Help us to be your hands and feet and be lights on a hill for you. We will praise you, and we will rejoice in the mountaintops and in the valleys as well. We ask all these things in your precious Son's name, and just put a hedge of protection around us and our families and our loved ones as we go through our day. Amen.
At this time, we would like to do a roll call of board members beginning go to my right today. Nancy Norris Johnson.
Dr. Renee Dodson.
Mary Stewart.
TJ Adams.
Sandra Culpepper.
Jeremy Cummins.
Lacey Gentry.
Carly Walker.
Janelle Moody.
Beverly Oliver.
Drew Calhoun.
At this time, we would like to ask those on Zoom to announce themselves, please.
Alvino Castillo.
All right, now that we've gotten our roll call done.
Is that everybody on Zoom?
No.
As far as board members.
As far as board members, okay, we'll just need everybody's name.
And so at this point, now that we've accounted for all of our board members, could you name yourself that are on Zoom today?
I'm Jackson Oliver. I'm Beverly
LV.
Oliver's son.
I'm sorry. Alvino Castillo. Can you hear me?
Yes,
Thank you.
Did y'all hear me?
yes.
All right, thank you.
Are there any others on Zoom?
There's quite a few people on Zoom.
Even if you're a part of the public that has joined the Zoom, we would need you to announce yourself.
So we have a Zoom caller with ANC iPad from ECTR 2019. Can you identify your name?
That is me, Alvino.
And we have Cindy, can't see the guys.
Hanson.
Ms. Hanson, can you identify your name? Okay, we have Mr. Dwayne Jameson. Down here.
Yes.
We have a iPhone user. Can you identify your name, please?
Yes, it's Gabe Pierce with Blue Cliff College.
Thank you. We have a Tamika Luckett.
Yes, Tamika Luckett.
Thank you, Ms. Luckett. Right, set for Ms. Hanson.
Okay. All right, with that being said, thank you all. At this time, before we begin board business, we would like to swear in our two new board members, and we are going to begin with Ms. Oliver first. So Ms. Oliver, if you could join me up front here. Right hand. I, Beverly Oliver, do solemnly swear that I will faithfully support the Constitution of the United States and the Constitution of the state of Mississippi and obey the laws thereof, that I am not disqualified from holding the office of registered nurse practitioner, member of the Mississippi Board of Nursing. Of the Mississippi Board of Nursing. That I will faithfully. That I will faithfully. Discharge the duties. Discharge the duties. Of the office. Of the office. Upon which I'm about to enter. Upon which I'm about to enter. So help me God. So help me God. Congratulations, Ms. Oliver. Thank you.
Let's go, Mom.
Next member will be Mr. Andrew Calhoun. And I, Andrew Calhoun,
I, Andrew Calhoun,
do solemnly swear
do solemnly swear
that I will faithfully support
that I will faithfully support
the Constitution of the United States
the Constitution of the United States
and the Constitution
and the Constitution
of the State of Mississippi,
of the State of Mississippi,
and obey the laws thereof,
and obey the laws thereof,
that I am not disqualified
that I am not disqualified
from holding the office of
from holding the office of
registered nurse,
registered nurse,
member
member
of the Mississippi Board of Nursing,
of the Mississippi Board of Nursing,
that I will faithfully
that I will faithfully
discharge the duties
discharge the duties
of the office
of the office
upon which I
on which I
am about to
am
enter.
about to enter.
So help me God.
So help me God.
Congratulations, Andrew.
Personal preference. I know Miss Oliver's family's here and they may have to leave. Could we get a picture with Miss Oliver and the family and her husband and her son, please?
Absolutely.
And I'm not sure if do you have any family members here? Okay, we'll get you next time.
Yeah, we have it. We took it before the meeting.
Oh, did you?
Uh-huh.
Okay, okay, great.
Thank you, though. I appreciate that. At this time, we would ask our executive assistant, Ms. Vanessa Gray, to step forward as she is entering retirement this month. And so the staff and board of directors would like to thank you, Vanessa, for your years of service and dedication.
Now we can't see. 2 years ago.
Thank you all so much. I would do a speech, but I don't know why I'm so nervous right now. I'm normally not short for words, but this really means a lot to me. I'm truly gonna miss all of you all. It's been a long time. I've enjoyed every moment of it. It's kind of bittersweet. I'm looking forward to retirement, but I'm not looking forward to missing seeing your beautiful faces and doing all the hard work, but I enjoyed every moment of it. And just thank you all so much for all your, and I'm a phone call away.
This time, we have a declaration of a quorum. Is there a motion to approve the agenda?
Make a motion to approve the agenda.
Okay, so we have a first and a second. All in favor? Any opposed? At this time, we would like to move into our open forum with anyone from the public that would like to speak. Good morning.
Hello, can y'all hear me? Okay, there we go. Thank you. Hi, I am Melissa Temple, and I am the Nursing Education Director for Mississippi Institutions of Higher Learning. And I just wanted to provide you with just a brief overview of our annual report for this last year. Our deans and directors complete an annual report by October of every year. And so I was just going to give you a little bit of information from that report. And I did put a handout at each of your seats as well. Mississippi has 25 schools of nursing, and you can see those identified by type of institution on the handout. We have 17 associate degree programs, 9 baccalaureate degree programs, 7 master's, and 8 doctoral programs in the state. We have 41 degree program options, and they have multiple entry points for students to enter. During the academic year 23-24, there were 3,865 admissions across all programs compared to 3,924 for the previous academic year. So that's about 59 students difference from last year. Overall, admissions have decreased about 2.3% over the past 5 years. And that decrease has been seen at the associate and the baccalaureate levels. We've actually seen some increase in our graduate programs. If you do look at this, if we break it down into pre-licensure programs, there has been a decrease in our BSN programs, but that's been in the post-licensure program option in the RN to BSN. However, that pre-licensure option has had almost an 8.5% increase in admissions. Mississippi schools did report having more qualified applicants than they were able to admit. Enrollment in fall of 23, there were 5,810 students enrolled across all programs, and that is a slight increase when compared to last year's enrollment. But overall, there has been a 3% decrease in enrollment across all programs, with associate degree programs having the greatest decrease in enrollment. Graduates during the academic year 22-23, there were 2,630 graduates across all programs, as compared to 2,557 for the previous year. So we had 81 more graduates this past year. Nurse faculty vacancy rates in Mississippi, the rate continues to increase, with the highest being reported from our community colleges. We had 33 vacancies reported in fall of 23. We have 117 nurse faculty and deans in fall of 23. They reported that they plan to retire in the next 3 to 5 years, and that represents about 24% of the full-time nursing faculty and deans. Our NCLEX RN passage rate for calendar year 23, associate and BSN programs combined had a 99% pass rate, and our programs do continue to outperform the national mean. Yes, very good. And I'm happy to answer any questions that anybody may have.
Any questions from the board members?
I have a quick question. Dr. Temple, you said there were 33 faculty vacancies. That's across the.
That is across.
Okay.
Yeah. Yes, total.
And Dr. Temple, do you have any insight you might help the board with on how to eliminate those faculty vacancies?
I think the discussion is still, you know, when they report vacancies, it mainly has to do with faculty salary rates, and that a graduate with a graduate degree, they can make more in practice than they can in education teaching. So there's just a large gap in faculty salary and practice.
The only question I have, Dr. Temple, is do you guys have a plan perhaps to assist with that vacancy rate?
Well, we did ask for, each year we're asking for across, it's not just nurse and faculty increase in salaries, but for increase in salaries for all instructors and professors and Because Mississippi is still lower than our region. So, yeah.
Any other questions?
Just great appreciation for you and all you do for nursing in the state of Mississippi, Dr. Tim.
Thank you.
Thank you, Dr. Temple. You guys are doing a great job. Is there anyone else from the public? At this time, we'll move forward with the legislative update from Mr. Bobbington.
Good afternoon or morning, I guess still. To Dr. Temple's point, we were talked briefly, Ms. Gentry, before the meeting began, and she was giving me those, the 33 vacancies. And first thing we talked about was trying to increase nurse educator salaries. And as she said, from an IHL perspective, they want to see all their professors and faculty try to make more. You know, we hear a lot about the Southeastern average for teachers, which is a great thing. And the legislature's been making some progress on that, but I feel like this group and our faculty at our universities also need to be included more in talking about what our regional average is and trying to move that up. But that's just I know you have a big interest in that and the board does as well. I just wanted to mention something on an aside to begin with. I do this every year, Phyllis. The Neshoba County Fair is coming up on July 26th, and it will run through August the 2nd. And you go, well, why the Neshoba County Fair? Well, most of your statewide officials, Mr. Cummins, as you know, Ms. Culpepper, they show up and speak at this rally. It's a very informal setting where you can actually get one-on-one time with statewide elected officials as well as a number of legislators. And if you've never been, it's a lot of fun, actually. But just dress very casual and take plenty of water because it's kind of hot over there. But it's a good thing, and you will have a lot of policy makers that affect things. This board does. So I'm just saying, for those that have never been, it's a good experience, and you'll see a lot of people over there. Some people you know as well. I don't want to be too redundant and trying to wean off my Baptist ways here, Miss Phyllis, but I don't want to rehash too much of what we talked about at our board retreat, because I did a pretty in-depth legislative overview, but I just wanted to mention a few quick things that I think we're going to see again in the 25 session that we saw in the last session. First thing I want to start with, and our lawyers behind us will be very familiar, and thanks. Also, they were helpful in doing a summary for us on the Fresh Start Act. You've heard of that. The original bill passed a few years ago. And the intent was to take people that had prior convictions and kind of make it easier for them to enter into the workforce in all occupations, including the nursing profession. So I think the intent is a good one. As we always say, the old saying, the devil's in the details. We just have to be careful that it doesn't go too far, because I know this board is vested with patient safety in this agency, protecting the public and the patients. And so our biggest concern was our nurse licensure compact. So I put a lot of effort, work into this and talked to a lot of legislators. We got put into the bill that the nurse licensure compact would be excluded from this bill. Now, this bill ended up passing the House and dying in the Senate, as I recall. What we wanted to be sure that we didn't do something to adversely impact our nurse licensure compact, because as our executive director knows, many of you board members, certainly our legal counsel, you can't just amend a multi-state compact. You follow that they have their own process and procedures. So if we go and do something adverse to the compact, then we could risk losing our standing, and that would not be good. because of mobility and those kind of things. So we had our amendment in there just in case. And it ended up the bill didn't pass, but I fully expect it to come back. Like I said, I think the general intent is good. We obviously, we want more workforce participation and those kinds of things. But I think we got to be sure again that there are some parameters to it. So full practice authority, it's an issue to you two new board members. You'll probably get tired of me and some others mentioning that phrase, but it's very important. It's legislation that we want to do. And I know many of our current board members heard it many times. It's not about scope of practice, period. It is about allowing folks to practice to the full extent of what they've been educated and trained for. And we just want to see some changes in the current law to allow our APRNs specifically to practice without undue restriction or regulation, I think would be a good way to put it. We're going to continue that effort. There's a great coalition of our professional associations out there and others, honestly, that in the business community and others that see a need and a purpose for this. So we will continue to talk about that. Senate Bill 2799. I saw this bill early on, and I think I called Dr. Johnson and Shan and said, we talked about it. And I said, well, look, I'll take a look at the bill tonight. 3 hours later, I got to the end of it. It was right at 500 pages. So it's 491 to be exact. But with this bill, it really addressed the makeup of all our state boards and commissions and agencies. And it impacted, of course, regulatory boards like ours. It really, like, for instance, in this board, the original bill, which is not what passed, but the original bill has introduced, for instance, how we have associations that make recommendations to the governor on appointment. That would have been eliminated. There was a concern, not by just this agency, but many, that the executive directors who we know run the day-to-day operations, whether it's this agency or other, would have to do the advise and consent of the Senate every 4 years. So it's kind of like you're doing a good job, but it doesn't matter. 4 years later, you're subject to another. That in and of itself is not a problem, except it's kind of, every executive director reports to a board that I'm aware of or a commission in the state. And what you don't want to do is get it to where it's too political, or, you want it to stay focused on the mission of the agency. So I think that was something. And the other thing was, many agencies and boards under this bill, there was no specific language that required you even had to be licensed as a professional. So you might have a construction person or somebody from a totally unrelated field appointed to a board, not just this one, but there were others. That's a concern, obviously, because we know how technical your work can be here, particularly when you start promulgating rules and regulations. Your hearings, you've got to understand the subject matter and what it's about. So anyway, the good news is a bill passed, but it went from 500 to 66 pages, only impacted, I think, approximately 13 agencies. However, the reason I'm mentioning it again, we could see the bill, Shan, come back where they might want to include additional agencies again. So I just mentioned that to you. There again, there's probably some good reasons for some of the change, but there again, we just want to make sure it doesn't adversely impact the agency. Thanks to Shan Montgomery again and our staff, and Shan in particular, and Dr. Johnson. We had, for you two new board members, we do subcommittee appropriation hearings every year where we present our budget. And our team here does an outstanding job of putting substantive information together to present. and we have to make a request and we get asked questions, and Dr. Johnson provides a presentation. And I think Shan would agree. I think we turned out pretty good on our budget this year. We certainly got an increase in our funds. I will say this, regardless of the agency, you probably never get everything you want, but I think we did pretty well overall, certainly when compared to other agencies. So I think we did good, but the budget's always important. So the staff here and whatever you guys determine the direction of this board, that you're adequately funded to do that. Very quickly, Medicaid expansion didn't pass. Hot issue, you all know that. Actually, it got fairly close there at the end of the last session. The big issue was the work requirement. The House and Senate kind of had different definitions, different ideas about that. Obviously, that issue is coming back again. It's too early to know what will happen, but it's going to be out there. PERS, Public Employees Retirement System, legislature appropriated $110 million to shore up that program. One good thing for this agency is, and Shan knows this dealing with our budget, it would have required the end of last year, 23, the PERS board passed an employer contribution increase. It's going to be 2% per year for like 3 years. Maybe, and one of those years might have been 1%, but at least 2 were 2%. Under this bill, the legislature said only 1/2 of 1%. In other words, which means that would be coming out of the budget here. So that's a good thing from an economic standpoint. We want to protect our retirement system. That goes without saying, but we also don't want to put an undue burden on our budgets. Or the legislature was saying we'll have to come up with more money because all the agencies are going to be asking for more money because their employer contribution rates are up. So that got capped. And in the future, the PERS board makes a recommendation to increase. It has to be approved by the legislature after they recommend it. That's currently not in the law. So I just wanted to mention that. I get a lot of questions about that. As far as this upcoming session, well, before I mention that I told some of you about House Bill 1640. That is a very comprehensive mental health bill. I understand from legal counsel, you had some hearings this week that dealt with perhaps some mental illness or issues related to that. And that's going to tweak the commitment process. It's going to try to divert people from outright commitments and also to keep mentally ill patients out of correctional facilities, out of jails, which I think we can all agree. Someone's sick, they should not be in jail. Nobody I know of wants that, but it's been a necessity because of the lack of beds and facilities to house people that are mentally ill. And the legislature is doing some work on that. And I think you'll continue to see more work with it. And lastly, I'll just say the upcoming session, along with Medicaid, you're going to see a big push on tax reform, elimination of income tax discussion, but also a reduction in the sales tax on groceries. I think you're going to hear more about that this session as well, which obviously impacts the state budget too. So with that, I'll open it up if anybody's got any questions.
Do any board members have any questions for Mr. Bobinger?
If not, I appreciate your time. Thank you.
Thank you. At this time, we're going to move forward to practical nursing education, or I'm sorry, the Office of Nursing Workforce. Would you like to go ahead and do the presentation, Dr. Burks, or do the report? At this point during the meeting, we would like to recognize those that have served on the ONW Advisory Committee. They're here with us today, and then we have a few that were not here. So as I call you up, if you could come receive your plaque, And of course, wait, because Dr. Burks wants to get some photos of us. So for the first one, we have Megan Kendrick. Next, I have Dr. Audrey Murray. And we have Ms. Ruby Denton. I don't want to read off the name.
Yes, agree.
For those that couldn't be with us today, we want to thank Ms. Wanda Troop, Juan Wolf, and Megan Hines for their participation on the Office of Nursing Workforce Advisory Committee as well. And so we want to say a great big thank you to you guys. You have done a phenomenal job over the last couple of years, and we wish you well in all your endeavors. Dr. Burks, would you like to?
This is the Office of Nursing Workforce and the M&V report. ONW has a student nurse retention scholarship, and as of date, 18 recipients have graduated. We have 1 scheduled to graduate in August, 4 scheduled to graduate in December, and 7 of those recipients have completed their service work agreement. We also have the ONW Nursing Program scholarships. And as you notice, there is some data regarding the fiscal year 21, 22, 23, and 24. For the fiscal year 2024, 1,168 scholarships were awarded. As of date, 253 of those recipients have taken boards and they've completed. The total amount awarded for the scholarships was $842,100. And the information we're receiving is ongoing. As you all know, students graduated in May, so they are still in the process of graduating. Attached to the report is also a detailed list of all the students that received scholarships and their schools, as well as their discipline. And so it's broken down again by schools. It shows the amount they received and what type of program they're in. Also, as we prepare for the upcoming year, the nursing program scholarship forms, those forms are going to be mailed to the schools starting Monday, July 29th. And the new deadline is August the 14th. And one reason for that is in the past, there's been multiple forms. We've combined and condensed those forms to decrease the amount of back and forth so that we can get that information to the parties that be in a timely manner. This year, the amount to be distributed to the schools is $860,000. In regards to the ONW newsletter, that is something that's new that was started earlier this year. We're currently taking submissions for the ONW newsletter, and the deadline is August 23rd. And one of the things that we're going to spotlight in the upcoming newsletter are those students who receive those scholarships. The MSTART grant, we're still in the process of working with the grant, and we've started gathering data for the grant according to the objectives that we had. And one of those objectives focused on the use of the equipment. And I've included a chart to show the schools that have reported the use of the equipment in regards to their simulation. And simulation is where many of the schools are utilizing that equipment. We have listed the colleges and universities that are a part of the grant, the simulation training hours, as well as the percentage of the time they've spent in simulation. Again, this is ongoing, and as time continues, we will provide you with more information regarding the remainder of those objectives as well. In MMVP, they're currently monitoring 31 participants, with 1 being referred to legal. They had 1 participant to graduate on Tuesday, and there's 3 pending. 1 is currently in treatment, and we're waiting for the assessment on 2 others. We also have with us an intern from Belhaven, and her name is Miss Kaylee White, and she will be with us the remainder of the summer and the fall. She's in the back. In terms of community outreach for ONW and MMVP, Northwest Mississippi Community College had a mental health day, and Miss Casey Loper, she presented at that mental health day. The PN Council Retreat was in Mississippi Gulf Coast, and Miss Whitty, she participated, and Miss Whitty will be participating with Mississippi Community College Board, their CTE conference, which is scheduled for August 2024. That is the end of the report for the Office of Nursing Workforce. Do you have any questions at this time?
Any questions from the board members? for Dr. West?
Ma'am, if someone drops out in the middle of the semester, are they required to reimburse the money back to ONW?
No, currently that is not one of the criteria for the scholarship program.
Okay, thank you.
Any other questions? Thank you, Dr. Burks. We can move on to the practical nursing education report.
For the practical nursing education, the first item I have 3 items for recommendations. The first is Hines Community College, their accreditation visit. It is scheduled for 2025. Currently in our standards, it requires that programs submit hard copies of the self-study and any pertinent documentation. And Hines has requested the option of creating and submitting a digital repository. And since, again, it is in our standards that it's hard copies, I do recommend that they be allowed to submit a digital repository instead of the hard copies of their documents for the site visit, which will occur in 2026. The next item is Copiah Lincoln Community College. And they had their site visit June 18th through the 20th of 2024. The site team members for that visit was Dr. Lisa Pearson from Itawamba, Ms. Jamonica Johnson from East Mississippi, and Ms. Amy Myers from Jones. The site visit determined that 2 standards were not met, and it's in terms of curriculum and the outcomes. And attached is a detailed report from that site visit specifying what all of their entities look like. But I'll give you an overview for Rule 3.5 curriculum, criterion 1. The hours in the handbook, as well as the calendar for the Natchez campus, did not reflect option 3 in the curriculum. And option 3 is the option that Colleen selected. The total instructional hours for the curriculum is 990 hours, whereas the Natchez campus, they had 1,013 hours. In addition, the program did not provide any documentation indicating a request for a change in hours, and that information would have been submitted to the Mississippi Community College Boards, because colleges and programs do have the option of decreasing or increasing an hour. Also with Rule 3.7 outcomes, they did not provide any documentation to verify the program outcome related to their program satisfaction and job placement for the Natchez campus. So based upon the standards, it is recommended Colleen be given provisional accreditation, by which the program has 60 days to submit a plan of compliance for meeting the standards. Afterwards, the program will have 24 months to submit the required follow-up report.
Madam Chair, I'm sorry. Can we take these one at a time? Do you mind if we address these one at a time?
Yes.
That's fine. Is that okay? So, can we go back to the Hines Community College? Okay. So, obviously, I don't have any problem with this if it's your recommendation. I'm just a little curious about the format for the digital repository and how that's going to be safeguarded.
They're gonna have it encrypted on jump drives. That information is encrypted. Now, some information will not be on a digital repository. For example, their faculty files, that is going to be on site once we get there.
Okay.
But there are some documents, for example, the catalogs, student handbooks,
Right.
and sometimes those catalogs can be very large. And so instead of them printing off 300, 400 pages 4 times, they're going to place that on those encrypted jump drives.
Sounds good. Okay. So can we vote on that? So I make the motion that we approve the change to the standards and allow digital repositories to be used instead of hard copies for Hines and other colleges as Dr. Burks determines moving forward.
You will have a second.
I'll second.
All those in favor say aye. Any opposed?
Aye.
And then on the COLAN, and I should know this, so I'm admitting that I probably should know this. So they have 2 campuses.
Actually have 3.
3. Okay, so the discrepancy in the curriculum is the hours are inconsistent based on campus?
Yes.
So what was the explanation?
Somehow when the person was typing the information, they typed it wrong in the book, and we never could figure out, and they could not explain exactly where they got those hours from. Because one of the things we were looking at, well, maybe they transposed them and reversed the hours. But as we went through the entire curriculum, they were not. They were just wrong and in error. So the second part was to go back and look at MCCB to see if they had requested permission to increase their hours at some point or decrease their hours. But that was not the case. There was no documentation, and through their interviews, they said that they had not requested any changes. So those hours were all. And because although a school may have multiple campuses, they're actually one. And so with the numbers being off on that particular campus, it threw things off for the entire program in terms of their curriculum.
Okay, that's helpful. And so on Rule 3.7 on the outcomes, specifically related to program satisfaction and job placement, you said for the Natchez campus, is that the same, basically, that?
It's the same thing.
So you're not asking for my campus?
They ask for it by campus, but then they have to put that information together and give you an overall. And so their overall did not reflect that Natchez campus. And again, those were off as well.
They didn't have the data?
They could not find that data.
So I make the motion that is there?
Yeah, so Dr. Burks, on these visits, first of all, thank you. I know what's involved in those visits. It's very tedious. And your due diligence shows, as the discrepancy was noted, to ensure safe and competent nursing education programs. So thank you and your team. So when you, these visits, are y'all with a national accreditation team, or is this, this initial or provisional visit, did you go out, was there a national accreditation team with you is my question?
No, because the state of Mississippi does not require the practical nursing programs to have a national accreditation.
Okay.
That is optional, and they do not have national at this time.
Okay. Okay. So COLAN does not have national, but now many LPN programs in our state do too.
Only 2. There's 15 practical nursing programs, and only 2 have national accreditation. They are Mississippi Gulf Coast and Meridian.
Any other questions?
I probably should have made the motion before I started the questions anyway. I apologize, my Robert's rules. I would make the motion then that we support this recommendation that COLAN be given provisional accreditation status with 60 days to submit a plan of compliance for meeting the standards, and the follow-up period of 24 months to submit the report.
Second.
All those in favor say aye.
Aye.
Any
Aye.
opposed?
Okay. And Blue Cliff College had a follow-up visit. That follow-up visit was June 25th of supposed to be 2024. The original preliminary visit occurred October the 24th through the 25th of 2023. And I'll just give a background on that preliminary report. During the preliminary visit, it was noted that they did not meet 6 of the 8 standards that they were required to meet. So on June 25th, the team went back to Blue Cliff, and the team consisted of Dr. Melissa Bryant of Pearl River, Miss Teresa Cold of East Mississippi, and Miss Betty Ginn of Northwest. And this visit determined that they were compliant with the following standards of governance, faculty, staff, students, curriculum, resources, and outcome. And that report well to show the difference in the original versus when we went back for the follow-up. And they had done a yeoman's job in having everything in place and compliance. We also spoke to their potential clinical sites, and their potential clinical sites had one of the best plans I've ever seen in place for onboarding, as well as preparing their staff for practical nursing students coming in, because we know with practical nursing and licensed practical nurses, their scope is different. So they had a plan in place to help educate those registered nurses so that they would understand the scope and the value of those practical nursing students. So based on the findings during the follow-up visit, it is recommended that Blue Cliff College receive approval for stage 2 and qualify for initial accreditation. In addition, Blue Cliff must comply with the requirements also set forth by the Mississippi Community College Board, Commission on Proprietary Schools, and Registration.
So do we need I need to get a motion before going to discussion?
Before discussion, we need a motion.
Okay.
Yeah, I make a motion that we approve the recommendation of Blue Cliff College, reach stage 2 approval and qualify for initial accreditation, with the addition that they have to comply with requirements set forth by MCCB, Commission on Proprietary School and College Registration.
Do I have a second? Okay. Any discussion?
I'm selfishly interested in the plan of the scope of practice. It sounds phenomenal. So that onboarding process, Dr. Burks, that was just something they created to.
It's something they created with their chief nursing officer, which is new to her role or the position there because the previous chief nursing officer retired. So one of the things that she set in place is mentors for those registered nurses, and to educate and have a plan where they are educated. And it was written out in terms of what that education looked like, looking at their scope of practice. So they talked about the Board of Nursing website and going to the Board of Nursing website, as well as using the curriculum, which many people do not do. And I think sometimes people don't even realize that it's out there. But to help utilize the community college curriculum in order to teach and educate those nurses so that there will not be role confusion, because that is always an important part, is that role confusion. If an RN is doing something, LPNs see them doing it, if they don't discuss and share with them, although this is, my role and function as an RN, however, it is outside of that scope of an LPN. If they're not told that, surely when they're training, because again, they're being educated, then there can be some role confusion, and you can have an individual leaving a clinical experience thinking that it's within their scope of practice.
I see. Perhaps Blue Cliff could be asked if they would care to share that. Would that be an appropriate ask of them to help disseminate information regarding scope of practice for RN LPN if it delineates it well and it's something we could use as a resource?
We could look at it from the hospital, because this is information that came out from the interview with the
Got it.
facility.
Okay. Thank you.
Any further questions for Dr. Burks? With that being said, all in favor say aye. Aye. Any opposed? The motion moves forward. Dr. Burks, anything further?
I'll just share with you all the upcoming site visits. We have a site visit scheduled for Meridian. That is September the 10th through the 12th, and that will be done in collaboration with ASIN. The members of that team is Dr. Sutton from Holmes, Ms. Stephanie Greer from Southwest, and Ms. Summer McBride from Northwest Mississippi. Northeast Community College is scheduled for September the 23rd to the 25th. That visit will consist of Ms. Veronica Carradine from Mississippi Delta, Ms. Lakeisha Powell from Jones, and Ms. Tammy Caldwell from Holmes. Kahoma is scheduled for October the 16th through the 18th, and Itawamba is scheduled for October the 21st through the 23rd. And in terms of community outreach, I attended the PN faculty retreat. That was at Mississippi Gulf Coast on the 24th. The NLN Research Committee meeting was June the 2024 as well. I participated with Mississippi Delta Community College pinning ceremony on July 8th. And we have upcoming Pearl River Community College pinning July 22nd. And MCCB CTE conference will be a presenter in Natchez, and that will be August 2024 as well. And that is the end of my report.
Thank you, Dr. Burks. Is there any questions for Dr. Burks in regards to the information she just covered with us?
I'm sorry, go ahead.
Before we end, Blue Cliff is here today.
Dr. Burks, are any of these site visits a surprise site visit or are they planned?
They're planned. They're all planned.
Not
Talk
like
about
joint
losing
commission.
faculty in the state. They would all quit. We. Oh,
So with that being said, thank you, Dr. Burks, for a phenomenal job as always.
Yes.
Next is the Executive Director's Report. Dr. Johnson?
Good afternoon, Madam Chair and members of the board. I just wanted to take this opportunity to say that, you know, we assumed the practical nursing education program in 2019. And now it's fully under the Board of Nursing, under your umbrella. And I just say that Blue Cliff has done a phenomenal job from beginning. They're the ones that got it. And Dr. Burks and I, she's debriefed me on everything that has been going on with Blue Cliff. So this is your first school that you're approving in the state of Mississippi under the legislation that was granted to us in 2019. And when she came back, Dr. Burks, and showed me the program and where they began, they bought into it, they met, they did everything they were supposed to do with the Board of Nursing. And they have created a stellar program and worked with their community, the hospital facility, to be a place for these people to go. And these our nurses, our potential nurses, to go and get their clinical. So they did everything right. So they created the roadmap and they told me they were going to be here today. And I think, you know, I want to thank you all for accepting that and doing what you need to do as the leaders of the board, and then Blue Cliff for doing what they needed to do to try to get potential nurses, especially in that part of the state. So you're our first program that's been approved under totally the Board of Nursing. So I think that deserves a round of applause. Okay, now, Lacey, like you had something.
I just want to say, mouse clap. I know what you just did, and that was a tremendous undertaking. So thank you for all of your hard work to ensure that that nursing program is efficient and effective and will meet the needs of Mississippians. So kudos to you and all those that assisted you in that process. That is huge, huge. I don't think people realize the enormous, undertaking that is. So good for y'all.
So thank you all. Moving on with the report. This report aims to provide you with important updates on nursing regulations, licensure data, disciplinary and investigation numbers. Since our last board meeting of June, I did give you a summation, although my PowerPoint is up there, so I will go from my summary sheet. 2024 NCSBN annual meeting in Chicago, August 28th through the 30th. The board members travel, staff travel to convene on August the 27th. The names of the board members registered for annual meeting are on the second page, as you will see, and Sandra Culpepper will be our LPN alternate delegate. Jeremy Cummins will be the LPN delegate. Lacey Gentry will be the RN alternate delegate, and Dr. Priscilla Burks will be the RN delegate. 2024 NCLEX conference is scheduled for September 12th, and that is a virtual conference. To my knowledge, that has not changed. We also have the policy conference, which will be held October 9th through the 11th, 2024 in Charlottesville, Virginia. Additional information will be forthcoming on the registration for that particular conference. The JNR editorial board meeting will be August 26th. Dr. Burks is a member of the JNR, which is the Journal of Nursing Regulation editorial board, and she will be attending that meeting on August the 26th. And of course, she's mentioned the conference in that, the Career Technical Education Conference, July 30th through August the 2nd, where we will be in attendance. Dr. Burks and I are also speakers at that conference, and we will have ONW also with a booth there. Operation Nightingale, as many of you know, that's the fraudulent school situation that came out in 2022. It is ongoing. There are no new reports from Mississippi, I am happy to say. However, there are new schools still popping up. And as soon as that information is available to give to the public, then I will let you know what those new schools are. It continues to be an ongoing investigation because these schools, fraudulent schools, are still alive and well. Board visibility, you can see that we have participated in numerous activities since the June meeting. Just to name a few, I did attend the Holmes Community College PN pinning ceremonies. Dr. Burks and I kind of tag team on that, and she's been doing a lot more of that due to my schedule. But I must say, Holmes in Madison, they had it in Madison. It was phenomenal to see the graduates, the LPN graduates, and their families, and how proud they were of becoming and entering into the nursing profession. So if you ever have the opportunity to attend a pinning ceremony, please do. It was refreshing to see that. Licensure data, you can see the licensure data that we have for you. There has been a slight increase from the last month. So in both the LPNs and the RNs, as well as our advanced practice nurses. So we are continuing to monitor that. I know Dr. Temple talked about the nursing and how the schools have people waiting to get in, but there's not enough faculty, and also saw a decrease in some areas. Well, that's kind of consistent with the national data in that there a lot of people wanting to go into the nursing profession, as opposed to in 2020 when COVID hit, when people were leaving the profession. We're seeing a little bit of a reverse now. There are people wanting to go into the profession. Part of the issue is the faculty available to teach those students. There are waiting lists for many schools across the nation of students trying to go into nursing, and this is PN all the way up to your master's level prepared nurses. So more to come on that. We're not where we need to be, but the trend is reversing a little bit, so that's always good news. You will see the disciplinary actions for June. Thank you for the hard work that you do during this matter. They're posted on the PowerPoint as well. So you did a good job with that. And you can see that since January 1st, the board has issued 60 letters of concern, which, as you know, that's non-disciplinary, but it does put them on alert that you need to change your behavior and what you're doing. Otherwise, you could be brought back before the board. So kudos to you all for the work that you do. Regulatory updates that I want you to be pertinent of is the Part 2840, Rule 1.3. The temporary rules suspending the monitor practice hour requirement in 2021 expired in 2024. So an email blast was sent out to all APRNs advising them of the change effective August 1st, 2024. An additional notification was sent out via our social media outlets to inform RNs that may be transitioning to that APRN status on or after August 1st, 2024. We have not been inundated with a lot of phone calls. We have received a few, but most of those are just for clarification purposes to make sure they are adhering and when it will go into effect. So the Administrative Code Committee will be meeting later on this month, and this is one of the issues that will be put on that agenda for additional discussion to see how the board wants to proceed with that. Letter of support, I did receive notification from Alcorn State University School of Nursing. They have requested a letter of support from the board regarding their application to the Nurse Education, Practice Quality and Retention Workforce Expansion Program grant, which is the HRSA grant. The program focuses on supporting learners from marginalized communities in rural counties. And to address these pressing needs, the ASU School of Nursing has developed what they call the Brave Beginnings Workforce Expansion Program, and it focuses on supporting learners from the marginalized communities in rural counties. The program's key strategies include increasing enrollment and graduation rates, providing specialized training for acute and long-term care, enhancing practical training with virtual reality simulations, offering paid internships, expanding preceptors and clinical faculty numbers, and developing robust mentorship opportunities. As you know, we are participating in many levels of support in the past for other institutions, and this aligns with what we have done in the past. So I am bringing it before the board for your approval to submit a letter of support for Alcorn State University School of Nursing in support of this grant. And that, Madam Chair, is all I have, and I am available for questions.
So would there be any questions for Dr. Johnson this morning on the director's report?
For a motion on this letter of support.
We can go ahead and do it now. I was gonna bring it under a second, but we can do it now. So if you'd like to make that motion to accept it.
Yes. I make a motion that we accept and support the letter of support to Alcorn State University as Dr. Johnson has outlined in her report.
All those in favor? Motion will move forward. Thank you, Dr. Johnson.
Thank you.
At this time, we're gonna, if everyone is okay with it, Mr. Cummins will be having something he has to attend to. And so I'm gonna ask Mr. Cummins if he would go ahead and be able to start the next meeting.
Thank you, Madam President. You have your handout in your packet there that gives the budget breakdown. Fiscal year 24 has come to an end. We ended well with in the black, with money in the bank. That's always a good thing. And we've started fiscal year 25 on July 1st. So it'll go through June 30th of 25. If you're following along your handout, you'll see the budget, fiscal year 25 budget overview. We did have about a $523,000 increase in our budget for fiscal year 25. If you'll look at the strategic budget focus, you'll see the first area is salary progression. We were able to do a salary progression last year. We've also been budgeted to do it again this year. We have been able to hire quite a few of our nursing PNs for the Board of Nursing, allowing an additional 10% to our nurse new hires. So that's been very beneficial for filling those PNs. So we're thankful for that. One nurse has been hired in for ONW, and I believe there's 2 that are being hired into investigation. So that's great for us. Second is Office of Nursing Workforce. You see the number of $1,560,000 that's been put to Office of Nursing Workforce. That is a gross budget there. That includes administrative costs. You flip to the second page, you'll see that the net amount that would go for services out of Office of Nursing Workforce is $1,005,000. That still is an increase of almost right shy of $200,000 that we've been able to add to Office of Nursing Workforce. Projecting into the fiscal year 26, we're hoping to continue to propose to increase that budget to continue pouring into students and workforce. So you'll see under services, you'll see under services, we did have a decrease of $57,900 for services. That's due to a lot of one-time expenses that we had last year. We didn't need that money again this year. So you'll see the one-time purchase. The breakdowns are some examples of that's below. Employee and board member assessment tools that we got, some training programs that we did, and then inventory contractor. Those were one-time expenses that'll have long-term benefits. But that's where our one budget cut was that amount for services. Under employee benefits, the budget includes the funding for the increase in insurance and retirement costs that Mr. Bobinger spoke of. And then you can see a detailed breakdown if you look below. I'm not gonna read that out to you, but you'll see that we did have some increases in some of our areas. As far as fiscal year 26, I know it seems like, well, we just started 25, but now we're looking forward to fiscal year 26. If you have anything that you want to propose to go into the fiscal year 26 budget, it was announced 2 months ago. We'll need to know by the end of business today, as Shan's trying to finalize that fiscal year 26 budget and get ready to submit our request. So we need that now. Most importantly, as of June 30th, the Board of Nursing had cash on hand of $6,510,174.40, which by all means is sufficient to maintain and continue the work of the Board of Nursing. I'm open to questions if there are any.
I have one with the salaries. There's flexibility if you're hiring someone that has a lot of experience in a certain area. Is that the range that we're approving, or is it discretionary upon the?
The range has been set, and Shane can speak more to this.
Okay.
The range has been set by the Personnel Board. However, we have the flexibility of 10% above that. We're given the flexibility of a 10% above the range that the Mississippi Personnel Board gives us.
Any questions for Mr. Cummings? With that being said, would anyone like to make a motion to accept the? So with that said, we'll move forward. So now that we're back on track, you guys, sorry about that. We're gonna go back to board business. So with that being said, we're gonna start with the business meetings for June 7th, 2024. Do I have a motion to accept those?
Second.
All those in favor, say aye. Aye. Any
Aye.
opposed? Next is hearing panel minutes for February 2024, April 2024. Is there a motion to accept those?
I'll second.
All those in favor?
Aye.
Opposed? Next is the agreed settlement proposal minutes from February 2024, April 2024, and June 2024. Would anyone like to make a motion?
I'll make a motion.
I'll second.
All those in favor, say aye.
Aye.
Any opposed? Next, would anyone like to make a motion to waive the reading of the names on the motions?
I'll make a motion to waive the names.
Second,
I'll second.
all those in favor?
Aye.
Any opposed? Okay, we're gonna move forward. Next is for future meetings. Once again, we will have an extra hearing day on Monday, September 30th. And so I will need a motion to move forward with that.
I'll make a motion that we add an additional day on Monday, September 30th.
I'll second that motion.
All those in favor? Any opposed? We will move forward. Administrative hearings and settlements, October 1st, 2nd, and 3rd, 2024 at 8:30 a.m. The business meeting will occur on October 4th, 2024 at 11:05 a.m. And for this, the panel will be Sandra Culpepper, Jeremy Cummins, TJ Adams. And at this time, we are needing an APRN. So if anybody would like to volunteer for the October panel for the APRN, please reach out to myself or Dr. Johnson. And that is the end of the board business. Next, we're going to move into committee reports at this time from the executive committee. There is nothing coming out of executive committee at this time. So next I'm going to move on to. Oh, I apologize. This does not require a motion. It's just an update to remind everyone that we did approve adding an additional day between hearing panels specifically for ASPs, which we had discussed, and we will start beginning in mid-January.
And I'll be submitting, Madam Chair, a list of dates for you to approve.
Thank you, Dr. Johnson. Next, we're going to move forward with the compliance committee. Ms. Johnson.
We do have, one thing. I move that the board adopts compliance committee recommends that we accept 3 compliance affidavits, 2. We denied 1 compliant affidavit, 2 with a summary suspension. And then we accepted 1 compliance affidavit, 1. Then, all that, we accept modification for 1 of them for maximum hours of 88 to 100 during where she works in, to her probation is up, and that's R 877-556. And then we approved additional educational courses with the topic guide that has been made up with the board.
So we have a motion on the floor. Do we have a second?
I'll second.
All those in favor, say aye. Oh, I'm sorry.
So the 100 hours is for the 2-week period as opposed to the 88. I
Right.
assume that has to do with where this individual's
She
working.
got, she got a
She got a
promotion,
promotion.
and it's during a 2-week work period that she's working.
Okay.
She's almost fine. She's almost done with her probation.
Okay. All right, thank you. I just need clarification.
Any other questions? All those in favor, say aye. Any opposed?
Aye.
Was there anything else, Ms. Johnson, coming out of compliance?
You made the motion. Who seconded?
I thought she made the motion. Yes.
Yeah. So moving forward from there, the Advanced Practice Committee, Dr. Stewart.
We don't have any business to come forward. I just want to say that we have a fabulous committee.
I would agree with that.
That's all I want to say. Really.
So with that being said, we're going to move forward to the Practice Committee, and Ms. Gentry is holding seat for Ms. Blank.
Yes, practice committee met this morning. We have, a few agenda items we are working on that we will bring forward to our October meeting. So I don't have a motion at this time, just an update.
Thank you.
Ma'am.
Next is for the Administrative Code Committee, and that would once again be Ms. Gentry.
So we are going to have an administrative code meeting virtually on Monday, July 29th at 3 p.m. We have some matters to discuss, and I'll be looking for that link if you serve on that committee, and thank you.
Thank you, Ms. Gentry. And at this time, the Office of Nursing Workforce, we had covered with Dr. Hurst earlier, and we've already covered the motions coming out of it. Any other committee business at this time? The only other thing I need to cover is just a reminder for the NCSBN annual meeting. I'm looking forward to that. And I know that we all look forward to it for Dr. Johnson over here. So I look forward to seeing everyone there on August 28th through 30th in Chicago, Illinois. With that being said, we've already covered delegates and alternates. And so at this point, we have no further business. So I would like to see if anyone would like to make a motion to adjourn.
Make a motion to adjourn.
Second,
Second.
all those in favor?
Aye.
We're now
Aye.
adjourned.
I am Kristen Love with the Mississippi Attorney General's Office, Special Assistant Attorney General, sitting in as hearing officer today on the appeals to the full board. I will call up the first matter on the docket, case number 2019-0386. The licensee is Lemitra Bilbo, license number P-334275. At this time, for the record, I ask the members of the board hearing this matter to state their names for the record.
Drew Calhoun.
Beverly Oliver.
Janelle Moody, Lacey Gentry,
DJ Adams.
Dr. Renee Dotson.
Nancy Norris Johnson.
Alvino Castella's on the line.
Thank you. Now, at this time, we will talk about what's going to happen today, the procedures. Each side will be allotted 20 minutes to present the reason why the decision of the hearing panel that's being appealed should be affirmed or overturned. And Ms. Bilbo, you may also, you may also allot time at the end. So if you don't use your full 20 minutes, you can reserve the remainder of the time to give more argument after board counsel provided. So now I will ask you
Brandon Walker.
the licensee, the appellant, Ms. Bilbo, present.
Yes, ma'am.
All right, arguments before this board shall be directed solely to the issues identified in the appeal and shall not introduce new evidence, testimony, or witnesses. Members of the full board may ask questions related to the issues identified in the appeal. At this hearing, the full board may decide to affirm the decision of the hearing panel, affirm a portion of the decision of the hearing panel, and return the case to the hearing panel for reconsideration of some portion of the order, affirm a portion of the decision of the hearing panel and overturn a portion of the hearing panel's decision, or overturn the decision in full in accordance with section 73-15-31, paragraphs 5 through 9 of the Mississippi Code. Don't believe there's anything further. If the parties are ready to begin, you can begin now, Ms. Bilbo. Before you begin, I want to ask the board that's here in this case to state their name for the record one more time.
Drew Calhoun.
Beverly Oliver.
Janelle Moody, Carly Walker,
Lacey Gentry.
DJ Adams.
Dr. Renee Dotson.
Nancy Norris Johnson. Thank y'all. for that.
Alvino Castilla.
Yes,
Alvino Castillo.
Castilla. Alvino Castilla.
thank you. We can begin now. Ms. Bilbo, you have 20 minutes.
Yes, ma'am. My name is Lemitra Bilbo. I understand exactly why my license was revoked. I have always admitted to everything I've done wrong. I understand what I've done wrong. I have followed procedures to stay in accordance to like what was given me to do. I honestly thought I did everything. And when I got the letter saying that I had fraud when I renewed my license, I honestly answered my license like to how I thought it was supposed to be answered. I don't know if I'm saying that right or not. The question asks, within the past year, have you been recently in a disciplinary program? I was under the impression that since I had completed my probation period, which I had came off of in October of 2020, I thought I was answering the question right. I wasn't thinking about a few months prior that I had voluntarily surrendered my license in Vermont. I honestly just forgot that. It didn't cross my mind. I was just like, okay, I completed my probation period, and that's why I answered the question the way I answered it when I was renewing my license. It wasn't my intention to commit fraud or anything like that on renewing my license. The thing that was brought to me like that I needed to do, I went to the psychiatrist. I did the probation period. My employer at the time, they were turning in, I was turning the weekly, I don't know what you call it, that I was given, they had to check off on what I was doing every week. I was faxing that to the State Board of Nursing, turning that in on time during my whole year of probation. So I was just honestly looking at the fact that I did my probation period and I completed everything that I needed to be completed.
Have you completed your argument, or do you want to reserve the remainder of
I honestly want to say, I really hope y'all kind of give a decision towards give me a benefit of the doubt to help restore my license, because I know what kind of nurse I am, what kind of nurse that I want to continue being. I know what I done was wrong. I don't know what I'm trying to say. My words are suck. I'm sorry. I'm gonna save it for the remainder. Yeah, so I can get my words together. So.
She has used, well, she has 16 minutes and 52 seconds remaining.
Mr. Walker?
Yes, thank you, Your Honor. Let me just start. I want to remind everybody that this is not a retrial of a hearing. This is just an appeal. So you're limited to what's in front of you, the record and the briefs. So it's not a retrial. And just to give everybody a background, and I think to Ms. Bilbo's credit, I don't think she went outside the record. So kudos to you, Ms. Bilbo. On October the 30th, 2023, the board sent a complaint charging Ms. Bilbo with complaint to notice a hearing. But she was charged with a couple of charges. You can look at the board order, it's in here as well. But she was charged with receiving action out of state. There was 2 charges for that. One, 73-15-29-1D. Another one is 73-15-29. I'm sorry. Mississippi Admin Code 2820, Part 1, Rule 1.2W, having a license denied, conditionally issued, reprimanded, placed on probation, suspended, or voluntary surrender. Those were 2 of the charges. She also was charged with committing fraud, deceit, and attempting to secure a license, engaged in conduct likely to deceive, defraud, or harm the public. And also she was charged with misrepresentation or deception in obtaining your license or renewing your license. And that was all sent to her, noticing her of her hearing. It was scheduled for February 6, 2024. The board received that notice back via certified mail signed. She did not show for her hearing. We went forward, the board went forward, her hearing went forward, and a decision was made. That's kind of the background. And so on appeal, I kind of already stated this, but there's 4 grounds that can be used to determine if that board panel's decision was valid or not, or should be overturned. One is if it was supported by substantial evidence. 2, was the decision that the panel made arbitrary or capricious? 3, was it beyond the power of the agency to make? Or 4, did the panel's decision violate some statutory or constitutional right? That's the only 4 grounds that can be used to overturn this hearing, or their decision. And I want to remind you that she didn't show. So anything that is raised here, which I've already addressed, couldn't be considered as part of this appeal. At the panel level, the burden that the board has to meet is clear and convincing. And so that decision is insulated if, as long as this hearing, this full board finds that there's substantial evidence. And the Supreme Court's defined what substantial evidence is, and it's less than a preponderance of evidence, but more than a scintilla or a glimmer. So it's very, very small. So at the hearing, she didn't appear. She didn't object to any of the evidence. And even in her brief, she admits to everything. Really what it came down to was she had a final order by the Vermont Board of Nursing. They found that she'd been arrested during a traffic stop. Excuse me, she was found in possession of a variety of prescription medications that didn't belong to her, but were patients of facilities where she'd worked at. She entered into a consent order with the Vermont Board of Nursing in 2019 and admitting to those violations. And then on May 24th, 2021, she actually surrendered her privilege to practice in Wisconsin because of that Vermont board order. And that's, the charges against her, as far as that's concerned, but nothing in the underlying board orders. It was only, here's her board order. She had 2 of them. She's in violation of the Nurse Practice Act. She was not charged with any of the underlying circumstances or facts in those cases. The other, the falsification charge, and I should say, if you look through the exhibits that are attached in the brief, Exhibit B6 is the first order, the state of Wisconsin one. I'm sorry. And then the consent order that she signed with Vermont is on page 23 of the exhibits. But the way the statute reads and the rule reads is that any certified copy serves as prima facie evidence of a violation of the act. So those copies or those orders on their own stand alone to show violations of the Nurse Practice Act. So that clear and convincing burden was met by the panel, by the board that the panel found. The other charge against her that I kind of mentioned a while ago was falsification on her application, is essentially what the charge amounts to. So she surrendered on May 24th, 2021. On November 3rd of 2021, approximately 6 months later, after she surrendered her privilege to practice in Wisconsin, she applied for her renewal with this board. When she was asked on that application, as I'm sure y'all are all aware, because y'all all filled out the same one, since your last application submission to the Mississippi Board of Nursing, have you been denied licensure certification, had disciplinary action, or is action pending against you by a Board of Nursing, regulatory agency, or certifying agency of any state or jurisdiction? She answered no to the question, and whether that was negligently or willfully, whether she did intentionally or negligently, she falsified her application because she had just surrendered. She didn't really address that. I don't feel like there's any need to go into the other 4, other 3 determinations for overturning the decision by the panel. She admitted to everything. Even in her brief, there was no evidence presented at the hearing to refute any of the evidence or testimony. You can look at the exhibits that were presented. And for that reason, the board should affirm the decision that was made by the panel. Thank
You have the 16 minutes and 52 seconds.
Yes, ma'am. I did miss the original hearing. I honestly, and it's completely my fault, it's nobody else's fault because I had the date wrong. I thought it was February 16th and I took off February 16th and it was February 6th. I noticed I missed it when I called the State Board of Nursing to get the time that I was supposed to be here, and I was advised that I missed it. So I wanted to be here, and I planned on everything to be here. I just had the date wrong, which is completely my fault, and I completely understand that. I really hope and pray that y'all take it in your hearts to overturn the decision. Cause it would, like he said, it was negligence when I was renewing my application. I did not think about it like me surrendering my license 6 months prior. I was just thinking that I had completed my probation period and it was over. So when I was answering it at the time in my head, I was answering it correctly. I wasn't saying, I don't know if I'm saying everything repetitive, but I wasn't planning on defrauding the State Board of Nursing on renewing my application or anything like that. I have taken a bunch of education through my employer, through Relias. The ongoing educational relies with different things, elderly abuse, neglect, all that good stuff. And the in-services, I make sure I attend all the in-services.
Your Honor, I hate to object, but that's outside the record. Any
Sorry.
remedial measures that she's made since then. I mean, if you want to give her a time back, I'm sure of that, but that needs to be stricken from the record. I would make that request.
Okay, sorry.
That made the decision in your opinion.
Okay. No, I think I'm okay. Ma'am?
Are you done with your argument or?
Yes, ma'am.
All right. This concludes the hearing in case number 2019-0386 involving the licensee. No, before we conclude, I'm sorry, does the members of the hearing panel, the members of the board, do y'all have any questions for related to the arguments you've heard today for either Mr. Walker or Miss Bilbo? No question. All right. This concludes the hearing in case number 2019-0386 involving the licensee, Ms. Lemitra Bilbo, license number P-334275. At this time, I'll entertain a motion from the board to go into closed session to determine whether grounds exist to go into executive session to deliberate on this appeal.
Make a motion, we go into closed session.
Second that motion. All in favor? Any opposition?
Aye.
Hearing none, at this time, I'll entertain a motion from the board to actually go into executive session to deliberate on this matter.
I make a motion, we go into executive session.
Second that motion. All in favor?
Aye.
Any opposition? Hearing none, the board is now in executive session. We'll return with its decision in this matter. record in case number 2019-0386 involving the licensee, Ms. Lamitra Bilbo, license number P-334-275. Ms. Bilbo, the board voted unanimously to affirm the decision of the hearing panel. Any questions?
No, ma'am. All right, thank you.
Next matter on the docket, case number 2021-0583, involving the licensee, Ms. Jennifer Cannon, license number R-912750. I am Kristen Love, the hearing officer assigned to this appeal today before the full board. We are here in the matter of case number 2021-0583. At this time, I ask the board to state their names for the record.
Drew Calhoun.
Beverly Oliver.
Janelle Moody, Carly Walker, Lacey Gentry.
Jeremy Cummins.
Dr. Renee Dotson.
Alvino Castillo.
Attorney representing the board, state your name for the record.
Brandon Walker.
And is the appellant, Ms. Jennifer Cannon, present?
Ma'am.
Now, at this time, we'll talk about what's going to happen today, the procedures. Each side will be allotted 20 minutes to present the reason why the decision of the hearing panel should be affirmed or overturned. And the appellant, Jennifer Cannon, you may allot time at the end. So you have 20 minutes, but if you don't want to use it all during your initial argument, you can reserve some time to provide argument, rebuttal, any rebuttal you may have, additional argument you may have after Ms. Peter Walker completes his argument. Do we have a timekeeper?
I do, me.
Right, arguments shall be directed solely to the issues identified in the appeal and shall not introduce new evidence, testimony, or witnesses. Members of the full board may ask questions related to the issues identified in the appeal. With this hearing, the full board may affirm the decision of the hearing panel, affirm a portion of the decision of the hearing panel, and return the case to the hearing panel for reconsideration of some portion of the order, affirm a portion of the decision of the hearing panel, and overturn a portion of the hearing panel's decisions, or overturn the decision of the hearing panel in accordance with section 73-15-315, paragraphs 5 through 9 of the Mississippi Code. If the parties are ready to begin, we can start now with you, Ms. Cannon, and this is your opinion.
First, I want to start off by saying I apologize that I wasn't here for the first hearing. I had moved and I failed to update the Board of Nursing with my new address, so I never got the letter stating when I was going to see y'all or when I was going to be here. So I do want to apologize for that time and not being here. Second, the failed drug test that I'm here about. Strongly, I know that that was not my urine. I'm not sure what I can say or what I can't say or what I'm supposed to say, but I did ask for a retest from that urine and they denied me. Monroe Regional denied me a retest after I did that. After I gave them that specimen and the way that the specimens were collected, it was not the way that I've seen any other facility collect. They were all there was like 6 or 7 people's urine sitting on a counter unlabeled. We didn't witness our urine going into each bag.
I gotta object again. And nowhere in the record is it talk about it. Just, there's a statement that says protocols were followed, and that's it. It's the only statement we have in the record from the hearing. As far as. Yeah.
Ms. Kennedy, do you understand the objection is that, the information that you're putting into the relevant manner?
Yes, I apologize.
So
Sure what I could or could not say.
just, you're limited to the, record before the hearing.
It doesn't mention that I did ask for a retest either. I don't know if I was allowed to say that either.
Okay, no, it's just what the panel had before it when it made its decision, that evidence that was before it, that's what you can,
Touch base on. Know what else to say except for that was not my urine. I would never jeopardize my kid's future, my future as a nurse. I love what I do. It is everything to me. And I would not jeopardize that by using an illegal drug. I didn't, I wouldn't ever. And I just ask that y'all allow me to show you, and I have a job now working at Forest General in Hattiesburg. I've never been in trouble. My license have never been in jeopardy before. Justify why I think Monroe Regional did this. However, I don't think that I can do that because it's not in it's not in anything in what y'all provided me. I don't think I can discuss it. But I just assure you that that was not my urine. I did not smoke marijuana, nor did I ingest it in any way. I'm willing to do whatever. With that being said, I am willing to do whatever possible to remain being a nurse. Nursing is my life. Nursing is who I am. It is everything to me. Without it, I don't know who I am. If y'all could just give me the chance to show y'all that I don't smoke marijuana, that I will not. I'm willing to take hair follicle tests. I'm willing to do whatever is required of me to prove that I am a good nurse and that nursing is my life, and I would never jeopardize that if given the chance.
Mr. Walker, Ms. Kennedy, you have 16 minutes, 6 seconds remaining. Mr. Walker.
Thank you, Your Honor. Again, let me just start by reminding everyone, this is not a retrial. This is an appeal. It's limited to what you have before you. That comes from our own rules. If you look at 30 Admin Code 2825 or 1.10 B2, it talks about that no decisions, appeal decision, no new evidence may be taken, no new testimony, no new witnesses. I'll give you a little background. There was one charge. I know y'all probably aren't exactly real familiar with it, but she had one charge against her, and it was a violation of 73-15-29-1L. And she engaged in unprofessional conduct because she had a positive drug screen for alcohol and illegal substance or unauthorized medication. That's rule 1.2 F1. The board sent a notice of hearing and a complaint on March 14th, 2023. Via certified mail to Ms. Cannon at the address we had on file. Came back unreturned, so they couldn't be delivered. So pursuant to 73-15-31-1, we published notice of hearing 3 consecutive weeks. That's all evidenced in the exhibits that were presented at the hearing. When the hearing went forward on July 18th, 2023, there was no evidence submitted to dispute or offer any defense to anything that was presented by the board. charging her with a violation of, or a positive drug screen. And as I stated, this is limited to the record. An action of the board panel is limited to the consideration that was determined. It's four grounds. I know I discussed this a while ago, but we'll hit them again. One is, was that decision supported by substantial evidence? Two, was the decision arbitrary or capricious? Was beyond the power of the agency to make, or did it violate some statutory or constitutional right of the appellant? If it doesn't meet those four grounds, if there's nothing wrong with that, then it can't be touched. That's the only grounds for overturning, and let me rephrase that. It's the only grounds for overturning an agency's decision. Again, she did not appear at her hearing, and so on appeal, because of that, she can't introduce any new evidence. That's one of the most fundamental rules and long-established laws of the Mississippi Supreme Courts, that matters on review on appeal that were not raised at trial court level cannot be raised on appeal. The burden at the trial, at the panel level, at the hearing, the initial hearing, was clear and convincing evidence. On appeal, in order to prove that, for this panel, this board to say that there was enough evidence, substantial evidence has to be met. They have to determine whether substantial evidence existed or it was supported by substantial evidence. And that's been defined as less than a preponderance of the evidence, but more than a scintilla or a glimmer. I know she mentioned some things earlier that were not on the record, such as the protocols or how the drug screens were done, that should be stricken and cannot be considered. At her hearing, evidence was presented that revealed she tested positive for THC on a reasonable suspicion drug screen. This was reported after she was displayed behavior. Evidence was presented of that. The drug screen was submitted, showing that she was positive for amphetamines, and also for THC. She had a prescription for amphetamine based on the statements that were made in the exhibits. If you look at the drug screen, is actually, since B6 in the tax exhibits is on page 13. It has in there, if you see, it is positive for amphetamines. It has her name on it. It's also positive on page 14. I'm sorry. Back to page 14. On page 15, there is a positive for THC. There is a statement. This was all presented at the hearing. It was properly introduced. The statement from the DON talking about how she had stated she had smoked marijuana. She didn't want to lose her job. Both these statements were put in there. There was nothing introduced to refute the evidence that the board presented that day that she was positive for marijuana. Those were the sole charges against her, and any argument she raises to refute that, just by the board's own rules and by law, cannot be considered. And so for this reason, Your Honor, the board met the requirements for service. That's not disputed. And we presented evidence that met the burden of the panel. So for this reason, we would ask that the full board affirm the decision of the panel. Thank you.
With everything being said, I just want to say I'm willing to do whatever it may take to remain being a nurse. It's like I said, nursing is my life. It is everything to me.
Question from the full board for Mr. Walker or Ms. Kennedy? Concludes the argument. If you don't have anything else to add, Ms. Kennedy. This concludes the argument and the hearing in case number 2021-058. The following licensee is Jennifer Kenny, license number R-912750. At this time, I'll entertain a motion to move to a closed session to determine whether grounds exist to go into executive session to deliberate on this appeal.
Make a motion to go into closed session.
Second.
All in favor? Any opposition? Hearing none, at this time, I'll entertain a motion from the board to actually go into executive session to deliberate on this appeal.
Make a motion to go into executive session.
All in favor?
Aye.
Any opposition? Hearing none, the board is now in executive session and will Right, we are back on the record. At this time, I'll announce the board's decision in case number 2021-0583 involving the licensee, Ms. Jennifer Cannon, license number R-912750. The board voted unanimously to affirm the decision of the hearing panel.
Does this mean that I can't ever be a nurse again?
No, it just means that the decision of the hearing panel that you were appealing, they affirmed that decision. Look at the terminology in that order, and there may be something in there that can provide you with some sort of guidance about what you can do next. Or you can talk to board staff.
I'll take that one. It does not. There's a process for reinstatement, and you'll need to work directly with the board and go through that process, and they're here to help guide that.
Any more questions? This concludes the hearing. Well, we can go ahead and, you wanna go ahead and depart? What do you say?
You
The AFD, I wanted to announce the decision on it, but before we left, there's one.
Modification.
Yeah, it was.
Was accepted.
Yeah.
Oh, yeah. Let me, just announce that. In case number, announce the board's decision in case number 2024-0077 involving the licensee, Mr. Thomas Cook, R-911683. The board, accepted the, modified ASB. It's concluded.